Hello and welcome to Health Chat Live. We're going to be talking to you today about maternity here at NorthBay Healthcare and what to expect when the big day arrives. And with us is Heather Troutt. She's the Director of Women and Children's Services. And just by way of a quick explainer, we were going to be taking you on a tour. But once again, it's baby palooza time at NorthBay Medical Center, so we're not going to actually get into a room, but that's okay. We can still answer your questions about what to expect when you get here. So, Heather, why don't you take it away and tell us about maternity here at NorthBay?
Thank you, Robin. Welcome to everyone. Again, I apologize. I hated to make that call to Robin this morning, but once again, that we are raining babies. So it's a very happy time. You hear the cries of lots of cute little babies everywhere. At NorthBay, our goal at NorthBay is for to have that, make it a great place to have a baby. And so what that means is that you guys have the experience that you need, the experience that you want, and the opportunity to share that with us, and so that we can do everything we can to make that day so special for you. It is an honor. I have been here for almost 20 years, and in labor and delivery is my background, and it has been an honor to bring so many lives into this world and be a part of so many special days. And so, you know, at NorthBay, depending whether you're having a vaginal delivery or a planned C-section, or you end up having a C-section for one reason or another, we do our best to give you that special experience with the bonding and having your baby after the baby's born go skin to skin with you, and really uninterrupted time for you and your family to truly bond. And so that's really special that we are able to do that. We've got all team members on board, and that's what makes us a very unique place. We are a baby-friendly designated hospital. We are the only designated baby-friendly hospital in Solano County. And so that just means that we're here to support you. We're here to support breastfeeding if that is what you desire to do. It's not all about breastfeeding. I want you to know that, but really honoring those decisions that you want and really creating that bonding between you and your support person and your baby. So I am open for questions, I guess. We'll take it from there.
Well, you talked about being a baby-friendly hospital, and it's not all about breastfeeding, but that's a key part of the baby-friendly thing is
Absolutely. Absolutely. We have two certified lactation specialists that are here 7 days a week. They don't work 24/7, but all of our nurses are also trained with the baby friendly and the breastfeeding modules and everything to really just kind of help support the breastfeeding experience. We also have an opportunity that some of our babies may not be able to breastfeed for one reason or another, but we are able to offer donor breast milk for those particular situations that warrant that as well, and just really to help support that bonding between mom and baby.
So when somebody comes to NorthBay and it's time to have their baby, do they stay in the same room postpartum as they did during labor and delivery, or how does that whole work?
That's a great question. So at NorthBay, we have what's called labor and delivery rooms, so LDRs. So basically, once you arrive at labor and delivery, you're placed in a room and you're admitted, and you will labor and deliver and recover in the same room. So basically the recovery period is about 2 hours after you deliver, whether it's a vaginal delivery or a C-section. Once you're stable, then you just move literally down the hall to the mother-baby postpartum section. And that's where you'll stay between 24 and 48 hours if you have a vaginal delivery. If you have a C-section, that could be between 48 and 72 hours that you will remain on that unit, on the mother-baby. So we also have 2 operating rooms on our unit. So if you were to have a C-section, you'll stay right in the same area, and we recover you NICU. You're not moving to an operating room somewhere else in the hospital. You stay all right here on our unit.
Okay. So does the baby stay in the room with you the whole time?
Absolutely. That is a big part of the baby-friendly experience. We don't have a newborn nursery. The baby stays right with mom and dad in the room 24/7. And that's part of us here to help support you through that, because I know sometimes that can be, it's a good thing. It's a very good thing. But your baby will be in there with you the whole time. After a C-section, mom and baby are kept together as long as possible and then transferred together to the recovery room, so that we can keep that bonding experience.
The only exception might be in the case of an infant that needs neonatal intensive care, right?
Absolutely. So, everybody comes and we all anticipate that nobody comes to the hospital and thinking that their baby's going to need special care or anything like that. But we are the only NICU in Solano County. It's a level 3 community NICU, which is really great. So we have that additional support that if your baby does need some help or extra care, that you can stay right here at NorthBay and both mom and baby are taken care of. So so if something has to happen, the baby will be taken in the NICU, which is also right here on the second floor, and we get the family in there as soon as possible.
So with COVID restrictions, who can come into the room? I remember when I was laboring, like every family member in my life wanted to come in there. But what's the limit now with COVID?
Yes, great question. So that has fluctuated over the past 2 years. So our current state, and it's also on the website because we try to keep that updated. But our current state is mom, when she gets admitted, she can have a designated support person. So whether that's dad, her mom, whoever that is, a designated support person, and in labor and delivery. She can also have one visitor who has to, on labor and delivery, can come 24/7. There's no visiting hours on labor and delivery. The other person that could be a part of the care in labor and delivery could be a doula. If you utilize a certified doula, a doula is someone that helps promote your labor and helps relaxation and all that kind of good stuff. They're also allowed. So it would be a total of 3 people max, but right now it's a support person and then a visitor that you have designated.
Okay.
Now, once you move to mother baby, your support person can stay with you 24/7, and then you can have 2 designated visitors. But once you're on mother baby, they need to follow the 9 a.m. to 9 p.m. visitor rules. Many people have asked if those visitors could be siblings. They can. They have to be within the presence of an adult, but they also have to, the big thing about the visitor guidelines is that they have to follow the COVID guidelines, and that's all laid out, whether you're vaccinated or you've had a negative COVID test. So sometimes that could be a little challenging, especially if there's young siblings. So.
And you said 2 designated visitors, but could you change who your designated visitors are each day?
Each day. That's correct. So, some of our moms stay 2 days. Some of they say 3. In the morning, they usually say, I'm going to have Mary and John visit. They're my visitors today. They can come in and out. But the next day, if mom wants to change it to, Nancy and Donald, then that's fine. But 2 designated has to be 2 designated on that same day.
Are the rooms private, or are you in a shared room with others? Or?
All of our rooms on labor and delivery and mother baby are private. They all have their own bathrooms and a place for dad to stay. In labor and delivery, there's kind of a sofa type thing because the rooms are quite a bit larger than on mom baby. And then on mom baby, they have really nice recliners that dads can catch some rest, or the support person.
I want to thank Sarah Healy. She's saying, hi, Heather, you do such a great job. Keep it up.
Oh, great. Thank you.
And just a reminder, as I said at the beginning, if you have questions, type them in. We'll see it. We'll be able to pass that along to Heather. So you said a person can have a doula,
yes.
But who delivers the baby?
So we have our physician group, and we have physicians here 24/7. So your doctor, somebody will be here 24/7. The nurse does a lot. If you've had a baby before, you know your nurse is one of your closest support people during this process. They're here with you. They help you push. They support you. The physician, though, will be doing the delivery of the baby once that time comes. And usually they kind of, they work in relationship with the nurse to know when the right time is to come in and deliver the baby.
What if a C-section is needed?
Yeah, so like we talked about, we have certain expectations, but the ultimate goal is that we have a healthy mom and a healthy baby, no matter how we have to get there. And sometimes babies tell us that they need to come out a different way. And so, like I mentioned earlier, we do have 2 operating rooms right near everything. So if that decision is made, consents would be signed, and we would take the mom into the OR. Dad or the support person would be able to join her as soon as medication was given and right before we're able to start. And like I said, they're able to see the baby. The baby can go skin to skin, even during the C-section after the baby's born, take photos and all that. We try to make it just like as if you were having a vaginal delivery, so you can have that experience that we all dream about. So,
just interesting fact here, I was one of the first people to have a C-section in this wing when it first opened up.
Yes.
It was a great experience.
Great.
You guys took good care of us. What does the mom have to bring with her when she comes to the hospital, or what should she bring with her when she's checking in?
That's a very good question as well. And so a lot of times we get some people that bring hardly anything, and then we have other families that it looks like we're moving in for about 4 or 5 days. Kind of depends on, and some people really are moving in for 4 or 5 days if you're having an induction or things like that. Often we encourage you to bring, the support person to bring some snacks or things like that. They can go in and out, but sometimes that's a nice thing. But really, very minimal. You need very minimal things. You're going to have a gown. You're going to have the pretty mesh panties that we give you, and you're going to want to wear those. You're not going to want to change because, things happen, and you don't want to mess up all your good stuff. If you want to bring your favorite pillow, that would be fine. A few cosmetics, but we do have toiletry items that we do give you. And then I would leave all jewelry, anything extremely valuable or anything, leave that at home. Or if you come unexpectedly, send that stuff home so that it's nice and safe, because there is a lot of movement. If sometimes significant others bring computers or things like that, if they're going to be here for a little while to watch some movies or things like that, that's okay as well. But most of the time, an outfit for the baby to go home, but for the most part, we really encourage skin to skin, and that means baby's usually in their diaper until they go home. The car seat doesn't need to be brought in until the day you're ready to go. So really, it's just, come maybe have a change of clothes when you go home, and keeping it simple.
And you mentioned the car seat. NorthBay will help you make sure it's installed right and all that before you drive away.
So what we do is, as we ensure that baby, you bring the car seat up, we make sure that baby is nice and snug in that car seat. We do not install the car seat. So what that means is that if you have one of the car seats with a base, that the base needs to be installed by the family. And then bringing the car seat up, we will help make sure everything is nice and snug and give you some instructions about the fingers and how tight things need to be. Now, if you have a large car seat, a universal car seat, obviously you're not going to take that out and bring it upstairs, because it needs to stay in there nice and tight. And we'll bring baby down, mom holding the baby in the wheelchair. But yes, families need to make sure those car seats or bases are installed, and we will help make sure the straps and all the things are nice and tight, and we'll go over that with you.
Wonderful. Are we testing all laboring moms for COVID? And what happens if it's positive?
Very good. These are all great questions that come up. So every patient that is admitted, or moms that are admitted, will get a COVID test, and we usually do the PCR test. If for some reason a mom comes in and it's going to be very quick, we will do a rapid COVID test so that we can get the results back within like 15 minutes. If it's we prefer the PCR, but that takes a little bit longer to go. But if for some reason mom comes back positive, we will also test the support person. So we just kind of know what we're dealing with. You will be put on isolation precautions. That's normal. But we will also provide trays for the mom and the support person, because ideally we kind of want to contain, keep everybody nice and safe. Baby will still be in the room with you. Baby will still do all the same things. It's just the healthcare team probably will have on a gown, a different mask, and that kind of stuff.
Does the baby get tested also?
The baby will get tested. So if mom is positive, the baby will be tested at 24 hours and then again at 48 hours if the baby is still here.
Is it automatic? Like if you have COVID, your baby has it? Or
No. For the most part, most of the babies are not coming back positive with COVID. So but we're doing that to just kind of rule everything out.
And it's usually a surprise, right? I mean,
yes.
Mom didn't know she had.
Yes.
So, what's the typical length of stay for the whole process?
For the whole process. So, like I said, if you come in and you're laboring and you get admitted and you deliver vaginally, you are eligible to go home at 24 hours, barring that baby is feeding well and you're doing well. But you can stay up to 48 hours after delivery if you're a vaginal delivery. If you're a C-section, most patients stay between 48 and 72 hours following their C-section. They can stay up to about 96 hours if needed. If for some reason baby is not quite ready to go home, but mom is at that 48-hour mark, then we will just keep mom and baby admitted, and baby will be now then kind of become the patient. So, yeah.
Okay. So, you talked about C-sections and what might happen and so forth. How, I don't know how to phrase this. How much do we push a C-section versus trying to give the mom a chance to deliver?
Oh, yeah.
I know a lot of moms have that question, like, are you just going to push me into a C-section, or can I try to labor for a long time?
C-section is the last thing that we want to do. And we're actually, part of a very big quality collaborative, really promoting vaginal births. And so we have lots of great tools. We have, I don't know if you've done any research on the internet, but peanut balls and ambulating. A peanut ball is kind of an assistive device, and it looks like a peanut, like one of those big yoga balls, but it looks like a peanut. And that's to kind of help position moms so that if baby needs a little help rotating down, that ball kind of really helps things. So we've got a lot of tools in our back pocket to really be patient and follow certain things and do certain things to promote that vaginal birth. And like I said, again, ultimate goal is healthy mom, healthy baby. And sometimes things can move. A C-section can be very calm in the sense of, well, baby's just not coming down. We've done X, Y, and Z. Let's plan to go back for a C-section. Or it could be a little scary thing if it's a true emergency. But know that your healthcare team is going to tell you everything that is going on and keep you as calm as possible. But sometimes that can happen.
Right. So I know some people who were tuning in today really wanted to walk around and see. Mm-hmm. So there are ways they can still do a tour, right? Yes. You want to talk about that a little bit?
Yeah, absolutely. So on our website, northbay.org, you can go into the Center for Women's Health and find out all the information about our prenatal classes. Through this pandemic, we've been able to do our Labor of Love class. It's a 2-week series. We do a newborn care class, and we also do a breastfeeding class with our lactation consultants. They're all free. And we used to do them in person, but now we've really adapted to the Zoom, and all of our employees are teaching that class. So it's really cool because they can give you all the information that's particular to North Bay. We also have a guided tour. You'll meet
virtual.
A virtual, yes, yeah. A virtual tour. So you can see the room, you can see the equipment in the room, things like that. So it's really nicely done.
Great. Can you talk a little bit about the sort of special equipment we have in the NICU?
Yeah.
Warming units and that sort of thing, and why NICU is such an important thing to have.
Yeah. So NICU, so we are a level 3 community NICU. So we have babies as small as about 28 weeks that come into our NICU. And we have neonatologists ready to go at any time that we need them. And so we have the isolates in the NICU. We have all the equipment necessary, even if a baby delivers at 24 weeks to stabilize that baby and take care of them. We also have, if your baby had to be admitted for the NICU, and sometimes babies are here, it could be a couple of days or it could be a couple of months. We have really cool cameras so that families, moms, dads, grandparents, people far, that couldn't come in or maybe live across the country or across the world sometimes, can see the baby. They're called NICView cameras, and it's really cool because you can log into you have to have a password, so it's a very safe, not everybody's logging in, but it's a really cool thing. So, and it's a peace of mind because you never know when your baby might need NICU. You could be 40 weeks and your baby might need some support of the NICU. And if a hospital doesn't have that, many times the baby's sent away and the mom's in one spot and the baby's in another. So that's a really cool thing about having a place where we can keep everyone together.
So we help all of our patients, even the tiniest.
That's right.
That's right.
That's right.
All right. Well, I think we're almost out of time here. Just want to thank you for helping us figure this whole thing out. I'm sorry that we couldn't take the tour, but as she said, if you visit northbay.org, go to Women and Children's Services, and you'll see under Labor and Delivery, there is a virtual visit on there, and takes you through a room, shows you ultrasound and all that good stuff.
Yep. All that great stuff.
All right. Well, the baby palooza continues. So we've got to let Heather go because I'm sure she's quite busy up here.
That's right. That's right.
Thank you all for tuning in. We'll have a chat next month. We're still figuring out the title for that and what we're doing, but stay tuned and we will see you then.
See you later. Bye. Bye.